Hello, everyone. My name is Dr. Ashwin Mehta, and I'm the Medical Director for Integrative Medicine here at the Memorial Health System. As part of our wellness and resilience initiatives, we have been partnering with organizational development, our cancer center, and Memorial Health and Fitness, and so many other aspects of our wonderful Memorial community in order to really promote wellness and resilience content in the context of these challenging times as we all face the uncertainty looming large in the pandemic. So I'm delighted this morning to be joined by Dr. Sameet Kumar, Dr. Michael Dressing, and Dr. Ximena Flanders. And Dr. Sameet Kumar is a clinical psychologist at the Memorial Cancer Institute with 20 years of experience working with cancer patients. He's written numerous books regarding grief, anxiety, and mindfulness. He's been with Memorial for over 10 years now and has been a real tremendous partner in providing what I can describe as only a Herculean effort with regard to promoting wellness in the context of these challenging times. So thank you for joining, Dr. Kumar. And Dr. Flanders and Dr. Dressing, please tell us a little bit about who you are and what you do.
I'll go ahead and start. My name's Ximena Flanders. I'm a pediatric psychologist. I have been with Joe DiMaggio for 2 years, although I was a student at Joe DiMaggio maybe 10 years ago when I started residency and before I went off to fellowship. I work part-time on our children's units, helping with children with chronic, acute or chronic medical illnesses that are just, struggling with coping and adjustment. So I'll help with them and their families. And I worked for about 8 years at Johns Hopkins, wrote a couple of publications and really enjoyed the academic, but I'm glad to be back in the clinical setting, working directly with families and children and adolescents during this time.
And I'm Dr. Michael Dressing. I am one of the pediatric sports medicine and orthopedic doctors at Joe DiMaggio Children's Hospital. I have been in South Florida for only about a year now, but before that I was in Tampa and St. Petersburg area, as well as Orlando. My roles right now are to see most of the sports medicine and orthopedic patients in a pediatric sense in clinic, but also am part of the Broward County Health and Wellness Committee and helping to cover a lot of the local sports teams, especially at a high school level, and making sure our athletes stay safe.
Fantastic. Welcome to you both. So, Dr. Flanders, just what are you seeing out there at this time? A lot of our content has been focused on the adult side. What are you seeing in the pediatric area with regard to stress, anxiety, worries, and fears in this context?
Yeah, so, there is a lot of anxiety, and I think the pandemic inherently just provoked a lot of anxiety for all of us, for adults, for children, for adolescents, every single one of us was some way, shape, or form affected from an anxiety perspective, especially when we feel that our health may be at risk or that our family's health may be at risk. When the country sort of went on like lockdown and folks were asked to be socially distanced and schools were being closed, there was a lot of anxiety then. And then what I think, and that's been spoken, people have been speaking about that for a while. I think what's more prevalent now is that there's this new normal that's shifted. People are habituating to being home and to being a little bit more isolated. Not to say that it's getting easier, but it's just that we're adapting more to sort of staying away from germs, from being home, being a little bit more distant from others. And I think what I'm seeing now is that there's this new anxiety that's brewing with this fear of reintegrating back into the community, or the conversations about school. What's it going to look like if I go back to school, or if virtual learning is what, these adults end up deciding for me, and what's safest for me. So there's this new, there was a sense of comfort that was sort of occurring with staying home, and now there's this new sense of heightened anxiety of what's it going to be like when I return. When we start attempting to resume back to the required activities like school and those sorts of things. It's another transition, so I'm not surprised that there's this new sense of heightened arousal around that. And I think parents and adults and are also feeling that sense of insecurity and that sense of anxiety. And our children are certainly taking the cues from us and from their peers. And so there's definitely anxiety all around us.
What advice would you give to parents or to children to help cope with these themes that, I think a lot of parents are struggling with themselves, the powerlessness, the uncertainty, the not knowing, the whole package.
The whole package. I think don't be afraid to have the conversation with your kids. I think a lot of parents sort of feel like the children or the adolescents sort of already know, or they've seen what they needed to see. And so they sort of, stop having the conversation. Excuse me. And I think it's important to have the conversation. Don't rely on the news or, don't rely on the peers, but, ask your children questions, help them find out what they know or what they're fearful of or what they're, they might have a lot of misinformation or maybe processed it in an inaccurate way that may heighten fear or worries. So have a dialogue, make sure that you're connecting with kids. I think in some ways this has forced all of us to slow down and be a family and, discuss more. And so use this as an opportunity to, listen to the kids about what they're struggling with. I think the important part to that also is have prepared statements of reassurance. The whole, we may not always get it right, but if we can transmit to our kids and to our children senses of safety, I think we're doing it right? So as long as we can prepare statements to reflect safety and that they're that the adults are doing what they need to do in order to provide them optimal, care and safety and those sorts of things, I think that's really reassuring. And I think that's a hallmark here to transmit positivity. And to that, trying to stay positive, this is very difficult for everyone, but seek opportunities to stay positive. These kids are looking to us for cues on how to manage and how to feel in new situations. So if we, transmit positivity and safety and those sorts of things, they're going to overall end up coping much better in the long run. This is an opportunity to teach our children about resiliency and, how to self-care for ourselves. Self-care is paramount regardless. In our life, we're going to grow up and become, career focused and, stress is everywhere. So this is actually a good opportunity for parents to sort of not only model effective coping, but to teach them how to stress manage and how to anxiety manage and those sorts of things. So also flexibility. Life isn't always, in the linear, we all wish it was a linear path, but, sometimes we have to take one step forward, one step back and readjust and that's okay. And learning about how to be able to stay flexible and positive. I think that those are sort of important key topics.
Communicate, keep the communication channels open, but also it's not just what we say, but also what we're doing.
That's right. That's absolutely right.
Yeah.
We hold ourselves to such high standards as both medical professionals as well as parents. Our goal is always to fix it. But these solutions might not be really readily apparent or readily available as we cope with this. So, just allowing ourselves that vulnerability as well, I think really also enhances the dialogue. And sharing our own concerns, sharing our own worries and anxieties. Oftentimes, it's tremendous how children can be healers in and of themselves, and they can heal us when we're not even expecting to be healed in the midst of these kinds of conversations. So, as part of coping and getting outdoors and really keeping up with our exercise and fitness routines, or resuming them if they've lapsed. Dr. Dressing, what are you seeing out there with regard to in the pediatric population in terms of sports medicine?
Yeah, thanks for asking that. That's a great question. We have, honestly been seeing a slightly different pattern of injuries recently, and part of it is expected, and part of it was almost not expected. And so, to begin, we've been seeing a little more overuse injuries, but not necessarily in the traditional sense. Usually we see injuries because we have baseball players that play for 12 months a year and they never get a break. Whereas now we're seeing people that have taken a couple months off of sports, kind of by necessity. And, this is a time when people are starting to resume. It's kind of up in the air whether fall sports are going to happen on which teams, and our high school is going to be open, our middle school is going to be open. And so we've been seeing some people come in as they're starting to get back into their sport of choice, who are starting to have these injury patterns that are almost an overuse injury pattern. But it's not because they've been playing for 12 months straight for the last couple of years. It's because they tried to resume their sport quickly, and they tried to get back to their normal activity level, but maybe just didn't realize that their body wasn't ready for that after having a couple months hiatus. And so we've been seeing some of these injury patterns that are deemed overuse patterns, but it's overuse in a little different sense. And so we've been definitely seeing a higher incidence of those. We're still seeing our normal broken bones and our normal knee injuries, our normal shoulder injuries, but we're seeing a lot of these kind of pains that are coming about, not necessarily from a fall, but maybe from resuming activities a little too quickly.
I understand. So, I also realize that you do a lot of community outreach in the context of your work, working with high school athletes. And, do you talk to coaches and parents about how best to prevent these injuries that you're seeing?
Yeah, that's a great question. So we don't necessarily have as much contact with coaches as we would like to, but one of our key kind of tools with getting our information out to the community, not only is the patient we see in clinic, but it's the athletic trainers that we deal with and the physical therapists that we deal with. And we kind of have a pretty good multidisciplinary team that can reach these different athletes and different kids of different ages and skill levels. And so we've been trying to get information out by different methods, and a lot of the best ways to reach them are the coaches, are the athletic trainers, are some of the therapists that these kids come in contact with, not just with us in the office. And so having the talk with them about how to gradually resume sports in a safe way, keeping up with proper nutrition, proper sleep, proper stretching, keeping your cardiovascular fitness levels as high as you can is definitely something that we've been talking about a lot recently. And so trying to get that message out to as many different people as possible, hopefully can reach the community in different ways. And also, emphasizing we have a lot of children that we're seeing that were converted to virtual school last spring. And it looks like that may be something that a lot of schools are going to in the fall. And so just, having that dialogue with people of, while you may not have organized sports at your school that you're used to and these activities that you're used to participating in with your friends, there are a lot of good ways that you can stay active at your house and in your community and in your neighborhood, while also, following social distancing guidelines, keeping a mask on, and not putting yourself at the high risk of getting sick. And so we've been trying to come up with a lot of ways for people to stay active around their house, whether it's with body weight exercises, whether it's going for a jog in the neighborhood, whether it's even, running on the steps, doing push-ups, things you can do inside your house, activities that get the whole family involved, kind of going back to the basics of what can you do with your family to avoid, just watching TV all day or playing on the computer. Just trying to come up with a lot of creative ways for these different athletes and children of all different skill levels to stay involved with their friends, with their community, but at the same time staying safe.
That's such a wonderful thing that you're recommending, and just kind of putting it together with what Dr. Flanders was talking about. You really get the sense of shared coping, right? These shared routines of paying attention to nutrition, sleep hygiene, and just these routines as a family participating in acknowledging the stress and of the anxiety of all of this, but just, here's something we can do together. Let's engage our bodies in healthy ways to endure this as a family. Right. It's such incredibly powerful advice. And, it can be a turning point in how a family operates together through this.
Yeah,
exactly.
I agree. There's so many, just from like a stress and anxiety management perspective, all the key points that Dr. Dressing was mentioning, the gradual approach, taking one step at a time, pacing, making sure that you're not getting ahead of yourself, recognizing things that you can control versus you can't control, so that you're, making strides to a goal, not necessarily jumping straight to the end goal. I think, establishing a daily schedule so that you can exercise and sleep well and eat healthy and those sorts of things. I think those are paramount. I think there's so many commonalities with everything that Dr. Dressing was saying, and just general good coping from an anxiety and stress perspective.
Yeah. And I love the thought that you guys have all brought up as well, of we're all in this together. And so whether, you are a 6-year-old who was supposed to start school this year and it's going to be hard because you're not going to be with your friends, or whether you are the adult that, has to kind of cope with all the kids in the house. I think, finding that common ground of we're all doing this together. We're all trying to stay safe and healthy, and we're all trying to enjoy this as much as we can, I think is a good common ground. While we have a lot of things in the world that are bringing us apart, I think this is something that can bring us together and help us kind of bond and stay close to the people that are close to us in our lives.
Yeah. Safety. That's the word you use, Dr. Flanders. Safety.
Yeah.
Try to get on the same page.
I'd like to sort of mention, if it's okay, sort of related, that I don't know where this fits in, but I think it's important to be said, because I want folks to know that there really is no right or wrong answer from a school perspective. I think a lot of folks have come to us and said to us, as a psychologist, social emotionally, should our kids be back at school, or should our kids be back in sports, and should our kids be, together, or should they be on virtual? Like, what's the right answer? And we know that there's, so many different options, but which one's the right one? And, I don't know that anyone has the right answer, right? But we know that from a safety perspective, there's things that are safer versus, potentially not, and I think that regardless of whatever path you as a family choose for your kids, or for, or your patients are choosing for themselves, and it may be different from what you would choose. I think that, I think it's safe, whatever works for the family and from a safety perspective would be their right answer. So being respectful that there are people are making different decisions based on their family's needs. And if your children are going back to virtual school, it can always be framed as, we're waiting until things are safe for all of us to come back together, or for the school safety. If your kids are going back to, camps and wanting to go back to school, and that's an option for you, I think it's important to remind them, or at least give them the expectations of what that may look like, because that also may be very socially and emotionally very difficult to see their friends in masks, not being able to hug their teachers, sit far apart. Lunch may look very different. Recess will look very different. And that in and of itself can be very traumatizing for a reintegration plan too. So prepare, whatever it is that you decide to do, just do your best to prepare, and keeping safety in mind.
I think I'd like to add also, just for a lot of parents, including myself, one of the challenging questions that we have is, what are the long-term implications of all this? And I think what you're saying is that we don't know. We don't know. But if we try and put these things into place together, safety being paramount, we may have better outcomes than expected, hopefully, but really nobody knows. Nobody knows for sure. We're just all going to have to try to do the best we can.
Yeah. And you're right, we don't know, but I think that this is also a really unique opportunity. And if we can all think of this as an opportunity to build inner strength, to build coping, to build stress management, to understand how our body reacts and feels to difficult situations, and what we can do, what strategies we can build so that we can utilize this not only now, but in our future. So this is also, can be seen as a growing experience for all of us, but especially for our children.
Well, thank you so much. All of you have such tremendous insights to offer, and really appreciate the tremendous work that you're doing, to help children during these challenging times, and really appreciate you taking the time to share with us this morning. So again, please do keep a lookout for additional wellness and resilience resources that we're putting together as part of the Wholesome Me section on our intranet. Do you have any comments about how anybody would access your services? Do you want to make a mention of how people get to you if they want to speak to you?
So I am right now, I'm exclusively seeing inpatients at Joe DiMaggio. I think we don't have an outpatient, a formal outpatient, but I am reachable by email. If you want to just look me up on the, I guess in the email intranet, feel free to email me. I'm happy to answer any questions that, some of my colleagues may have. In fact, I'm happy to even help connect them with, I'm glad you mentioned that, because I think a lot of people are fearful of reaching out to get the supports, because sometimes anxiety, stress, all of this stuff can be bigger than what we can manage on our own, and that's okay. I think asking for help is huge, and I think it's something that we need to normalize. So if there is something that I can do to offer to connect you with the right folks in the outpatient world, I'm happy to do that. Just email me and I'm happy to connect.
Yeah, and for me, I am seeing patients in an outpatient setting only, so I guess the opposite. And happy to direct you to our website is kidbones.net. We're happy to see people in clinic. And then one of the things that we've been adapting to, as well as I'm sure most of you guys, is telemedicine. So we've been having a lot more virtual visits and video visits to eliminate some of the patient contact, to help kind of reduce the spread of this disease for people that are able to do that. Obviously there's a lot of casting and other injuries that we can't do that with, but we are definitely willing to set up appointments in the office as well as telemedicine to help keep people safe.
Super.
Okay.
Thank you both so much for joining us. Really appreciate the work you're doing, and look forward to working with you. Take care.
Thank you.
Stay safe, everybody. Thank you.